Okay, so this is the patient assessment. This is my patient. First, I'm going to start with the scene size up. I do not note any sort of environmental hazards as we approach the scene. There doesn't appear to be any sort of possibility for fire. There aren't any sort of climate changes I need to be worried about. It also doesn't appear like this is a situation where violence was used. I don't note any other people besides the patient. There don't seem to be any sort of weapons lying around. I decide that the scene, because there's only one other person at the scene, I decide not to call for any additional services at this time, and I'm wearing my BSI and PPE and decide that it is safe for me to approach the patient. So first I have my partner go up behind the patient and hold C-spine as I come up to the patient and see if there's any alertness. I check and make a general impression. I note that this is a young female who does not appear to be in good shape. The skin is a little bit pale, and they do not seem to notice my walk up. As of right now, I decide this is a relatively high priority patient. I check to see if there's a verbal stimulus. Hello, ma'am. My name is Venice. What seems to be the problem today? Are you okay? There's no response to my verbal stimulus, so I decide to check to see if there's going to be a response for pain. I lightly pinch I pinch the earlobe, and there is response to painful stimulus, so I assess there's that. I decide to check her orientation, as after performing the LOC, she seems to start to regain her verbal capacity, and so I ask her event, place, time, and person, and she's able to respond, but seems very confused and out of it. She did not get the date correct, and so I'm still concerned. Next, I ask her what happened briefly. She tells me that all she remembers is getting some really bad news and then falling and fainting. And so I decide to do my check the airway. She's talking to me, so I think the airway it's fine, but I double check, make sure that there's no blood or teeth or vomit coming out. The airway seems patent. I check for breathing. I'm listening, I'm feeling, getting a rate, rhythm, and quality for that. The breathing seems a little bit shallow, but overall pretty within the normal range of breaths per minute. But even though it is shallow, I've decided to, because it is shallow, I've decided to administer oxygen and ask the patient if it's okay to put on a partial non-rebreather mask. She said it's okay. I then go and check on circulation. I feel the carotid artery. The patient has a very rapid pulse. I assess to make sure that there's no external bleeding. I note that my gloves are dry and there does not seem to be any sort of bleeding coming from the patient. I assess her skin temperature, color. Her skin temperature seems normal. Her color was pale when I first started, but it's starting to get more color into it. And her skin seems normal, dry. There isn't any sort of moisture, so that's good. I now ask if she has any disabilities and check to make sure there isn't any sort of identification noting for it. There doesn't appear to be anything, and I start my exposing the patient, making sure that I'm talking to her the entire time and that she's okay with it and understands what I'm doing. I then move on and decide to do my rapid assessment survey. So I start at the head, make sure that there aren't any sort of irregulations, GVD. I feel the scapula. I press lightly on the chest. I hold down with my thumbs on both sides and check for regular, even bilateral movement of the lungs. I press on the 4 quadrants of the stomach. To note for rigidity. I press in on the pelvis, making sure not to press down, just in case there's any sort of fracture from her fall. I move down to the leg. I start here and I move down. I have the patient lift up. I hold up the patient's foot and ask if she can push down and up for me. I move to the other side and start the same process, asking if she can push down and up for me. I then have my partner go and grab a board so that we can load her up into the ambulance, and I ask her, start taking her history. I ask her what her chief complaint is. She tells me that she feels really dizzy and anxious and is confused, and then I ask for her sample history. I look at her signs and symptoms. I ask for allergies. I ask what kinds of medications she's on. I've asked for pertinent previous medical history. I ask for her last oral intake, and I ask again what she remembers of the events leading up to her fall and fainting spell. I determined that this is a high priority patient and that we need to send her to the hospital because she did faint, and I have a suspicion that she's going through psychogenic shock along with any sort of other injury she may have sustained from her fall. So my partner comes back with the board. I ask to hold C-spine. I make sure to lift her and feel the back, make sure that there's no bleeding or anything else to worry about. Roll her onto the board. We load, get her into the ambulance, and I start taking my secondary assessment. We check her pupils, making sure that there's the pearl, they're even, and that they're responsive. We reassess the airway and make sure that there's no vomiting or anything else obstructing it that has happened since we've loaded her in. Again, checking on her breathing. The oxygen mask seems to be helping because her breathing's becoming more regular, less shallow. I check her circulation again, carotid and distal pulse, and she seems, even though she's still relatively rapid, 100 beats per minute, she seems to be better. I again decide to do a assessment, so I feel her head, I make sure that her back's still fine, I check the trapezius muscles and the scapula, and I make sure that her breathing is okay. I'm making sure to talk her through this whole process. I'm feeling her stomach again, I'm pressing in her hips again. I pull down her legs. I note that there's no difference in swelling between her leg. I lift up her foot, ask if she can pull up, pull down for me. I swipe underneath to check for the Babinski reflex. I do the same thing with the other leg, check for the Babinski reflex. I then take my vitals and check her blood pressure, making sure to wrap the cuff at the elbow, and use my sphygmoidometer, which I now have because we're in the ambulance, and I'm doing that assessment. I am checking her oxygen levels, making sure that the mask is working and if we need to adjust anything. And then I decide that because this is a high priority patient, that we are going to reassess every 5 minutes until we reach the hospital.